Good day, ladies and gentlemen. Welcome back to our channel. Like we do on this channel, we create health awareness, and our motive is to have a healthy community. Today, we have the Vice President of the Student Union Government of Bayo University, Kano. Although I should allow you to to introduce yourself. Um, but for the benefit of those who are viewing us, we're having the OO2 of the SUGB UK here. Can we meet you? We want to know your name.
Yes, my name is Najat Mohammed, and I'm from Faculty of Education, Department of Special Education.
Okay, you are welcome to this channel.
Thank you very much.
All right, so quickly, what we want to be asking you, they are based on your personal information, and some of them you may decide not to say it, like you may not want to be specific. We just want to know if you know them. That's what we are doing. So let me start with this. Do you know your genotype?
Yes,
Okay, and do you want to tell us?
AA,
AA. Okay, so and that means you can marry.
AA,
You can marry A.
and yes.
Okay, so that means you can marry anybody, right?
Well,
That's the
yes,
word I want to
that's
hear.
okay.
Of course.
But not anybody, shall?
No?
Not anybody, but yes.
Based on genotype, you can marry anybody.
Okay.
All right. So, and are you aware based on genotype there are some people who cannot marry or who should not marry?
Yes, I know SS and SS cannot marry. AS and AS have like a very low chance of not having SS child. But I have one question though. Does just because I am AA, does that mean like my blood is too strong that if I marry someone from SS, I will not have an AS child or an SS child?
I think my sister needs to come to classroom, but what she's asking is very interesting. Viewers at home, I hope you are answering that question as I'm going to do. When we are talking about genotype and we're talking about blood, they are different. Sure, you understand? That is one. Then two, when you are AA, AA is standing for two different things. One A, then second one A. That is your genotype. They just use the letter to symbolize them. Then somebody who is AS, that person has one copy of your A and another one that is S. The reason why they call it S, if you check this circle, this what do you call it, shape, you can call it circle or sphere or whatsoever. But if you decide to cut some part, you know this sickle they used to pluck all these fruits, the shape of that sickle. Yes. So those who have this genotype, their red blood cell takes that shape. Is not full. Do you get it now? So that is why they usually have crisis. The capacity of that blood cell will be lesser compared to the one that is circle. Sure, you understand? So that is what usually happen, and that is why it is advisable that someone who is AS should not marry AS, so that they will not have SS as child. Do you understand now?
Yes, I
Okay.
understand.
All right. So I'm asking you a question. You're asking me. I think that is very very interesting. All right. Do you know your blood group?
My blood group, that's O positive.
And what about your resource factor?
You said that earlier. I can't remember.
All right. So if your blood group is O positive, that means you are resource D positive, and that is good for a woman because ordinarily, if a woman has blood group of O negative or A negative or AB negative, are you aware there is a particular medical intervention the woman needs to have before she get pregnant?
No, I'm not aware.
All right. So there is a particular disease called resource disease. It occurs as a result of resource incompatibility. When the woman is resource negative and the husband is positive, their child is going to be positive. And as a result of that, the woman, when she's having a second pregnancy, our body will see that pregnancy as invader and start fighting it. We have a video on this channel which we term stillbirth resource incompatibility. Go to our videos catalog, check that video where we discuss extensively on resource disease. So, my sister, how often or how do you describe the kind of pattern with which you do your body checkup, like blood pressure, pack cell volume, the total blood count, and some other things like liver function and all those things?
Well, I don't do it very often, but because I had a little crisis with my kidney issue, with my kidney, I go for liver checkups and kidney checkups like after every six months. But the blood count, I'm not sure I've even, I think it was like 2016 or 2017. That was the last time I had that type of test.
All right, viewers at home, like we used to recommend on this channel, take your health very, very seriously. But our regular checkup, that is why we use the word regular, because it needs to be regular. There are a lot of things, like my sister mentioned, we have a lot of people today, they have one form of kidney infection or the other or disease because it has different category. For example, for a newborn, there is about 2 million nephrons inside the kidney that functions. But as we grow up, these nephrons they reduce in sizes. And because of the increase in workload and decrease in the number of nephrons, that tends to be much problem from the kidney. And that is why we need to be doing some tests. Ordinary urinalysis can save our kidney. Urinalysis, you just have your urine sample and they test it. This can save our kidney. So I appreciate that you do that and try to make sure you do other ones, especially your blood pressure, because a lot of people are coming with high blood pressure, hypertension, just because they do not know at the early stage. The fasting blood sugar, random blood sugar, that can help us to prevent diabetes mellitus, and that is why we need to do all these things. We have a video on this channel on diabetes mellitus type 1, type 2, gestation diabetes, and a lot of those ones. Please check the video, and I want to recommend that you also check the video.
Okay, I will.
All right. So
I have one question. Does hepatitis B affect the liver?
actually, hepatitis B or any form of hepatitis, they are disease of liver. So they cause inflammation of the liver tissue. And at a very serious case, they cause liver cirrhosis. In fact, it may lead to total liver damage, that the liver will not function. So, of course, yes, it does.
Just okay, but what if someone has a situation of hepatitis B? It's reactive, but they tell you it's not counting or it's not moving. I don't know. There was a particular situation with someone where they said the hepatitis is there, but it's not replicating or something, or it's not. Does that happen, or should the person continue with like the checkups and I don't know.
Actually, on this channel, we have video on hepatitis. You'll be surprised that we have a lot of videos. That is what we do here. So I want.
I look forward to watching all of it.
All right, thank you. So I will recommend that you check that video. We discuss about hepatitis and various degrees and conditions and reason why it also occur, how to prevent it, and how to manage it for those that have it. Now, when we are talking about the load, don't forget that hepatitis is a virus. Now, when they test the person and it reacts, it means this person has this virus. Now, when they do the load and the test and they see that the load is low, it means maybe the person has started taking some medication and that medication is beating it down, either in concentration in terms of number or in activeness. The hepatitis virus might be in that body system, but it might be in active state. And when it is in active state, it cannot be transmitted to another person. That's the beauty of that. But the person still need to go and meet the consultant who specialize in this field, and they give him proper care or her.
Okay.
All right. So we do appreciate your time for being on this channel, and we do hope if we call you some other time, you will grant interview.
Inshallah.
All right. Thank you. Our viewers at home, we do believe and hope that you learned one or two things from this interview session. If you are here to subscribe to this channel, this is the right moment to do that. You look at your screen, you see the subscribe button, click it, then don't forget, ring the notification bell so that when next we upload the video, you'll be able to benefit from the video. We do appreciate you for following us up to this moment. Thank you so much. Bye for now.